EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
And welcome to Community Conversations. How are you this week? I hope you're ready to listen to some really interesting things because as we get closer and closer to school returning, our attention as an organization certainly turns even more so than usual to our children. And so I've invited Dr. Elzoobi to come and speak with us about the things that are happening, the things that he sees as a pediatrician that are important, a little bit about our philosophy. I know that we've got some new people in town whose kids have not joined our school system yet, and you're probably wondering about getting a physical for them, or at least I hope you are. So welcome, Dr. Elzoobi.
Thank you so much. It's good to see you, as usual.
Well, and you were telling me before we started, because of AI and other conversations that we just had with the school district, you are an associate professor for Florida State University as well.
Yes, I am. In our institution, we get students, third-year students, that come and do their rotations. And we get them from 2 universities. And that enriches our practice. And we have a very special practice. These students really get to see a diverse community. I almost call it an international community.
Almost.
Yeah.
Absolutely. You know? And so we're part of the group that is trying to ensure healthcare for tomorrow and the year after and the year after that by encouraging students to go into medicine. It was a very popular choice many years ago, but then COVID certainly put a damper on that. Why put your life at risk was the saying, when I could do something that would earn me an equal and satisfying life without the danger. Thankfully, as a pendulum swings from one extreme to another, it does try to find a middle ground. And so we are seeing more students understanding the important role that they would play in anything having to do with health, whether it's nursing or dentistry or being a pediatrician. So,
So it's very important for us to plan for the next generation that's going to come in. And I know you, as a head of organization, you're always looking forward to that. And we, you know, when we get a student, we love to tell them, come to the dark side, pediatrics. No, maybe, you know, our pediatrics is a fun part of medicine.
It is.
You know,
children have still got so much joy and life and excitement.
Exactly.
Very few complaints out of kids.
Absolutely. It's more from the parents, actually. But also pediatrics can be very serious. And we are seeing lots of changes in our world. I mean, we are dealing with mental illness. We're dealing with obesity. But today I'd like to talk about that relationship you build with your pediatrician.
Very important.
Very important. And it starts from birth up to 18 years of age. This is a long-term relationship. And at our organization, I have to say we have highly qualified pediatricians. They have years of experience.
And we don't shift you guys around.
No.
Your patients are your patients for a lifetime.
And I'll tell you, our pediatricians are quite territorial.
Yes, they are.
That's a problem. We'll have to talk about that.
It's only a problem for you. It's not a problem for the parents.
So this is a wonderful thing when you build a relationship with your pediatrician.
Unfortunately, you guys don't work 365 days of the year. You like to take vacations.
I told you I want your ear for 5 minutes. I guess you jumped on it.
Okay.
So I'm going to start by talking about the importance of well exams. School is coming up, pre-K, kindergarten, and parents...
5th grade, 8th grade, it doesn't matter.
Parents think it's all about coming in, getting an exam, a paper signed. Well, you can do that. You can actually do that in an urgent care. You can do that through a school physical, but you truly lose out. This is the common thing. They find something abnormal, they send you to the pediatrician. Why repeat an exam twice? Go to your pediatrician. His job is to do a full exam.
And to notice the differences from year to year. And sometimes they're so subtle that they do not get recorded.
Yes, that's a very important thing. I mean, one of the most common examples, a child walks in and I tell the parent he's got a heart murmur. Oh, what? And
You
then
could
you
tell
have
just
to,
by looking?
No, by examining. No,
Okay, just checking.
No, so your examination ends up and you're going to explain, is it a benign heart murmur? It's not. So here's our organization. I gave this example. We are able not only to do a physical exam, to do referrals. And as a pediatrician for 30 years, I did private practice, university practice, that ability to connect your patient for referral department or labs is very important. When I go to my doctor, he sends me to the lab. That's another day out. So you come here, you end up, let's say you walk in, the child gets an exam, gets a vision exam. We even have eye doctors now.
Yes, we do.
So I'll give you an example. Last week I had a 15-year-old, and since 5 years of age, she's been telling her mom, there's something abnormal in my eyes. Very fascinating story. And she saw optometrists, and they told her it's nothing, and mom tells her it's in your head. The child was very upset, so I told her, sweetie, draw it for me. Okay? So I told her, let's turn off this light. I got my otoscope, had her focus on it, and I told her both eyes first, then close each eye. So she drew a halo around the light and lines.
Interesting.
Classic of astigmatism or keratoconus. I was like...
So you took the time...
Exactly.
And found out what she has been trying to say.
What she has been trying to say. So that's where your pediatrician comes in. That's where 30 years of experience comes in.
And she felt comfortable explaining it to you.
There's nothing like drawing.
And she had been ridiculed by everybody that she had told to. So most kids then would shut down and say, never mind.
And the progression. Okay. And I was so happy. I ran to the optometrist in the office the next day. I told her, come here. I want to show you something. She said, you're right.
How about that?
Yeah. Not only that.
And so corrective lenses were in order?
She's going to need hard corrective lenses or bridging surgery.
But can you imagine the struggles that she must have had in terms of her studies to that point?
It's not affecting her vision with studies, but during the night, she starts seeing these halos, and the light is a focused light breaks. Okay. So
as she turns into a driver on the road,
exactly,
that could be dangerous.
Yes.
Kudos to you.
Yeah, for me, I was like, wow. At 65, I still get excited. By the way,
not going there. So that is, I guess, what you're trying to let people know, that you don't always have to agree with what they're saying, and that would certainly be the case. A lot of our parents are coming in and they've got vaccine hesitancy, and we're not trying to tell them that they have to or they don't. We're very neutral on it. But for some of them, even though we think we're neutral, they might feel like, well, if I go someplace else, I won't have to deal with that conversation again.
So I'll tell you, and I always tell any parent, if your physician is judgmental, don't go to him. As simple as that. And I can tell you, our group is not judgmental. We understand vaccine hesitancy. We understand the social aspects of it. I may not agree, but I'm not going to force on you that if you don't get vaccinated, you're not going to be seen. And sadly, there are practices like that.
That's what I've heard. Yeah, I can't believe it, but
we took an oath to see everybody. Okay. Now, just bearing in mind, the danger is to the unvaccinated more than the vaccinated. Also, the danger sometimes when we are hesitant to see you on that same day, or we have a very busy practice, we have very small babies in the room. But that's a big topic. We should have a discussion about it some other time. But the issue is, for us, we're not judgmental. We're open, okay? And but on our aspect, we do have to give recommendations.
And the recommendation certainly has been for over 50 years. Well, I'll date myself, over 60 years that I know of, that it can be very different, both for the individual as well as those that cannot be vaccinated. I shared with you at one point, we had a gal who lived across the street, and she had ultimately 15 kids, I think.
Wow.
The oldest ones were helping raise the younger ones. In those days, it was not unusual. But we didn't have a vaccine yet for hard measles. And one of our family members had the hard measles. We had the typical neighborhood gang of kids that would go out in the street and play, and
everybody got it, and
everybody got something. And so, of course, we were all off limits to that because the mother actually had a miscarriage because the fetus was damaged.
Yeah, I'm going to give you a recent case I
Broke
had.
my heart.
So we had a unvaccinated child that came in, and actually he was following up for chickenpox. He had classic chickenpox, but he had a lesion on his eye, and he came in complaining of that problem. And basically, he had developed an ulcer on the cornea from the lesion. And this was, so I was able to do, it's an old test. You get forgot what's the name of the paper, a dye for the litmus
paper.
You put the dye, and I had the student, and
so you were teaching
so,
and
treating. I was like, wow, this is really old stuff.
Yeah.
And I showed it to the mom, and I told her it's not going to affect right now. Hopefully it will heal. But here comes again. Next day, she saw the optometrist. I'm very happy they're seeing kids.
Yes,
so
absolutely.
So that's that takes
service.
a lot, full service.
Yeah.
That's the nice word. It takes a lot of anxiety out of the parent,
Absolutely.
But going back to vaccines, they are very important. They are essential. We saw in this recent outbreak in Texas, I believe.
Yes, indeed.
But I will go back again as a
It's an individual choice. It has to be.
Yes.
And so we respect that.
Yes, we respect your choices.
So on that happy note, I want to take a short break for a word from our sponsors, because we could blow right through all 24 minutes that we're supposed to be on air, you and I.
Thank you.
Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of coastal furniture on the Treasure Coast. Sofas, love seats, dining sets, bedroom groups in the latest styles and colors from Four Seasons, Braxton Color, Riverside, Hooker, Capri, Tommy Bahama, and more. We're the outdoor furniture experts and have anything you need for your outdoor living from Lloyd Flanders, Kingsley Bate, Brown Jordan, and Woodard, including a gallery of maintenance-free furniture from Berlin Gardens and Pollywood. Right now, during our summer savings event, we have lots of great half-price specials, including 50% off on all in-stock Universal Coastal Living collections. And all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet and sales store directly across the street that is filled with name brand closeouts. And visit our website at sunshinefurniturecasual.com.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, where we provide primary care from birth all the way through whenever. And we try to establish a private practice type of model in that we want you to see the same person, develop a great relationship, feel comfortable with the questions, because there's lots of things on the internet that aren't really clear or that you don't agree with and would like to have a conversation with someone educated in medical or dental. But I think we take it one step further in that we really believe in the one-stop shopping approach, in that we know that you're very, very busy, and the more convenient we can make it, the more likely it is that you will get the services that you need. Not necessarily those that you want, but those that you need. And we're very proud today to have Dr. Elzoobi on board with us. He is one of our many fine pediatricians. He is, like many of ours, an affiliate professor at the universities that are teaching medicine. And we are, third year?
Here?
Fourth year? Yeah.
Yeah, I'm in my third year loving Vero Beach.
Yeah.
I don't miss the winters of St. Louis, I have to say that.
I can imagine.
Yeah.
So one of the things that we've talked about in the beginning of the show was the relationship and how important it is with the pediatrician and parents. And as the children grow, certainly that relationship develops with your children, and you want them to be more in the driver's seat. So we do more talking sometimes with the kids than the parents, and it pays off. To my way of thinking, we have many students that come back from college and ask to speak to our pediatricians because that's been their doctor for many years, and we oblige them. If they don't want to, that's fine. Some of them would prefer to talk about adult issues with adult non-pediatricians, but we're talking today about kids going back to school and getting ready for that full year. And, you know, we have a bit of a slowdown in summer often because the kids aren't all in the same place, breathing on each other, coughing on each other, swapping germs, however you want to say it. And so prepping the kids then for the best immunity often is about reminding them you cough into your elbow, not into your hands, you use alcohol, all the safety things that we can possibly give them. Remember to put on your seatbelt, look both ways before crossing. I've listened to these pediatricians of ours, and they really go through a lot. And, you know, the parents at first give us the look like, well, why would you ask that? Or why would you say that? Because it needs to be said, and it needs to be said several times because we want to keep your children safe.
I just want to remind everything, when you are coming to the pediatrician, so now we're going to enter, regular physicals, do them early so you're not rushed. And your doctor isn't rushed. Those 30 minutes encompass you coming to the office, your vitals, and seeing the pediatrician. The earlier you come in, those 30 minutes are yours, okay? You get to ask all your questions. You get to address issues that you were hesitant to address, and they gradually come out. Now, this well exam is not just about the doctor. We are going to emphasize again, just listening to the heart, saying, hey, do you get any chest pain, heart pain? You're fine, go play sports. No, we are screening for multiple things, and we are addressing multiple things. And we try to emphasize what's called a healthy lifestyle. And two things we need to address really in our healthy lifestyle: sleep hygiene nowadays, with all our cell phones, and
I have a 50-year-old. You don't have to convince me
exactly.
of health hygiene.
Not only that, I'm going to remind everybody, 20 years back, there was one TV in the room. Everybody watched it. Now there's TVs in bedrooms, okay? Turn off those TVs. Let your children get a good night's sleep. There's nothing better than a beautiful dream, you know? That's one important thing. Sleep hygiene is one of the most important things, what I see. Dietary issues. Don't miss out on a communal meal, sitting on the table as a family. Remember those old Rockwell pictures? They're real.
Yeah.
You don't have to do them daily. Do them once a week.
Mm-hmm.
Okay? Initially, it's going to be hard. All these teenagers, solemn, then they will open up, you know?
Mm-hmm.
This is one of the most important things. We talk about those things in a visit, especially when we have time and we're relaxed.
Exactly.
Okay? We address those changes that a teenager goes through, you know?
And so it relieves a lot of the burden of parent education. We're not teaching values. We're trying to teach safety and good health going forward. And so,
Yeah.
you know, I didn't want to have the Fact of Life talk with my 15-year-old. The pediatrician did.
Let me tell you, so
And then we could talk about
when I have
afterwards. You broke the
teenagers,
ice. Mm-hmm.
so I ask them, who's the scariest person in the room? Literally. And they look around.
Mom or dad?
Mom. Then
yes.
I ask them, who's your best friend in the room? And they say, Mom. And I then ask him, so would you go befriend somebody that's so scary? And they're like, no. I tell them, why did you answer that? I'm going to explain your feelings. You don't want to let mom down. But your job as a teenager is going to experiment, open doors, push boundaries. But here's the issue. You need somebody to give you good advice. When things go bad, it's not Dr. Elzoobi who's going to be holding you and supporting you. No, it's the parents. Okay? And so trying to explain these emotional issues in these terms brings us to another issue, mental health.
And I know mental health is a huge issue, but I can also say that there is nowhere in the United States that can generate enough mental health professionals to take care of all the things. So you are addressing a lot of the things that, again, in the 50s, 60s, and 70s, not everybody went to a psychiatrist or a mental health counselor.
I believe 1 in 20 in our population is dealing with mental health illness.
Oh, I think it's more than that, actually.
Yeah.
But
so, first of all, it's nothing to be ashamed of. Our world is very complex.
It definitely is.
It's a stress-generating world, you know, emotionally, financially. And teenagers and even little children are at it. So I'm going to go back to that well exam. When a teenager comes for a well exam, he gets, fancy word, he's checked for depression and anxiety by doing a battery of questions. Okay? And a lot of time I have to tell the parents, leave him alone, he'll answer. You know?
And sometimes we do have to excuse the parents out of the room.
No.
Yeah.
And sometimes, you know, you'll see the numbers go up and I'll tell them, so are you staying up all night watching TV? So that 3 for not sleeping goes down to 1. Okay, so those are important screening tests.
And so people need to get their kids in soon. And we are going to be off the air soon. You have been just a wealth of information about how you deal with different children, particularly teens. Oftentimes parents think they're fine, they're well, they don't need to go in. Please, let your children and let you have this experience. It is so worth it.
Before you let me off.
Okay. Last 30 seconds.
We have to talk about diet and obesity.
Okay, we will do that.
Thank you.
But we do have a new dietitian, just a little plug for Treasure Coast.
Yes, we should, both of them. Yes.
Comprehensive Services. Give us a call, and thank you so much for being here. Please share this with your friends and neighbors if you are able. We are on social media and lots of other places. So hope to hear from you next week, and we'll be back. Have a great evening.